Thank you, Oren. So I'm actually very excited to talk about this because it's something I've been looking into probably for the past 2 years now. And so I want to share basically what I've learned with all of you, and then I really want to hear kind of what questions you all have. Also, what concerns you've got about this program. So the question is, is private equity right for me and my practice? I want to first start by quickly answering a few questions that came up the other day. Healthcare is growing pretty fast. It grew 9.7% last year to 4.1 trillion, which is about 19.7% of GDP. It's growing faster than the GDP, and by 2028, it'll be 20% of GDP. And Basil did mention that it's like its own country. A few years ago, it was about $11,000 per person. Now it's over 12 and a half. And with all this spending that we're doing, as you can see, we are kind of in our own league here. The United States spends way more per capita than any other country in the world. But this doesn't really translate into great quality healthcare, as you can see in terms of care processes, which is like preventative care, safe care, coordinated care. We're kind of in the middle there compared to the other countries. And when you look at access, we all know access has been a problem. We're at the bottom. You look at administrative efficiency, pretty bad. Look at equity, even worse. And you look at outcomes, they're terrible compared to the rest of the country. The rest of the world. And overall, we rank at the bottom. And we spend the most. So if you look at the value equation, which I like to refer to quite a bit, and value is quality over cost, and in healthcare, quality is outcomes and patient experience. If costs are going up and quality is not improving, then we have a decrease in value. And a lot of people in Congress, they like to think that U.S. healthcare reform starts from the mindset of this large healthcare organizations are more data-driven, more efficient, and better at taking care of patients than private practices. But we know that better than that. If you look at outpatients treated at hospital clinics, visits to hospital-based practices associated with greater use of low-value services. That is, the MRI that wasn't necessary, or the lab test that wasn't necessary. And visits to hospital-owned community practices, they see more referrals that aren't necessary. And so, for most outpatient type problems, the hospital is less efficient and more costly. You look at the hospital employment model, someone was talking about the foundation model, and well, these models use these 12060 clinics, and if anyone knows what those are, it's basically the hospital has a clinic, the doctor uses that clinic, and the patient gets 2 EOBs. So for them to go to a 12060 clinic, say at Cedars, for example, to see someone for knee arthritis, they get charged way more than they would if they had come to a private practice. And there's lots of data there about this. You look at outpatient treatment in ambulatory surgery centers, the average cost savings is up to 60%. Surgical site infections are about half, and patient satisfaction is usually higher. So what are some of the challenges that we face as orthopods? Well, aging population is one challenge. Some people would say that's an advantage for us. Healthcare consumerism, people are picking their doctors. They're choosing them from the internet and from word of mouth and from Yelp and from health grades. We have market consolidation. We have hospitals that are buying up practices. We have private equity. And there's the pressure to adopt expensive tech. And this comes in like, for example, we were talking about outcome assessment tools and things like that, or even devices like robots. And then we have healthcare reform legislation, which is changing rapidly. Coding complexity comes in. We just heard a lot about that. And we have constant lowering of reimbursement rates. And to make things even worse, it's hard to find employees this day, post-COVID, and we have the rising cost just for staffing our practices starting to get unbearable. So here are some of the trends that we all notice. One is the rise in tech. The one thing I like about orthopods is we're all pretty much tech savvy, and a lot of the new technologies are coming out of ortho. And we have this continued shift to the outpatient centers. We have super groups and value-based agreements. There are some practices that use the membership and concierge model. And if you look at virtual care, especially in therapy and ortho, that's becoming more popular, and wearables like my Aura ring, that is even more popular these days. And then there comes private equity. So how can orthopedists remain independent and competitive in this rapidly evolving healthcare system? Well, we have these strategic options that are out there for us. We have the super groups, we have the orthopedic home, which is kind of like a care coordination center. We have co-management and professional services agreements, which were talked about earlier. Then we have the clinically integrated network, which is something that I'm very much interested in. Think of an ACO, a CIN. And ACO is a type of CIN, but it's more specific for Medicare. CINs can be used for PPO and private payers. And then there's the private equity. So as most of you know, private equity firms make investments in privately owned businesses, and a growing number of these firms are getting involved in the healthcare industry. They buy the medical practice or shares in what's called an MSO, or Management Services Organization, and then they increase the value by growing the practice and bolting on other practices, and then they sell it 5-7 years later for this second equity event. So orthopedics is really, really hot right now. It's one of the fastest growing segments in healthcare. And again, there's this rising demand for care because of the aged population, and there's a relatively low supply of orthopedic doctors. And practices, mature practices, have this ancillary revenue: imaging, therapy, DME, surgery center, and some have urgent cares. So private equity in orthopedics, it's a no-brainer. These firms have what's called dry powder. They have all this money sitting around because they weren't doing a lot of investing during COVID. And so they're looking for strategic investments. Independent orthopedic practices are highly fragmented, which makes them prime targets. And the sector remains relatively untouched, unlike dermatology, dentistry. And orthopedic practices offer access to additional revenue streams that a lot of those don't. And if we go back, these are those streams that are very enticing to the private equity firm. So just some definitions. There's this types of acquisitions. There's a platform, and there's a bolt-on, or a tuck-in, or add-on. A platform acquisition is the first acquisition that a private equity firm makes, and a bolt-on is those practices that are added afterwards to grow the investment. What makes a platform orthopedic group? Well, like I told someone who says that my practice would make a good bolt-on, I said, well, no one says I want to grow up to be a bolt-on. I want to grow up to be a platform. So what makes a good platform group? It's a well-established group with strong leadership, a history of growth, and it has in-house management. So all the services that are involved in running the practice, growing the practice, from soup to nuts, are within an organization like an MSO that's owned by the partners. And it helps to have targeted groups that can bolt on later.